from the first local station with news and high definition. This is 9 News Now.
Thank you, Kim. An innovative sports injury treatment did wonders for 2 of the Pittsburgh Steelers' biggest stars before the Super Bowl. Doctors say eventually the same procedure could alleviate the need for surgery for a host of sports-related injuries. With us now is Dr. Mayo Friedlis. He's president of the American Association of Orthopedic Medicine. Doctor, a pleasure to have you here. Everybody's been buzzing about this. It made the front page of the New York Times yesterday, and the procedure is called platelet-rich plasma. Tell us what this is and how it works.
Well, platelet-rich plasma therapy, also called PRP, is a novel, new way that's non-surgical that is changing the way the body heals. The treatment actually heals pain by doing a much more substantial healing process, a much more complete healing than the body could ever do by itself. It uses platelets. Platelets are blood cells that exist in the body, and the platelets have these little packets of growth factor and growth stimulants all over their surfaces. And when you're injured, the platelets are the first cells to arrive at the site of the injury. And they release all these growth factors and growth stimulants and start the healing process. And they also attract special cells called stem cells. And these are your own body's stem cells.
So
these
aren't that kind of controversial
not what you're hearing
yes.
about in the news. These are stem cells. Everybody has stem cells floating around, and it attracts them to the site of the injury, and they start the healing process and actually create new tissue.
And the thing that's really exciting and has people with their eyes wide open is the recovery time. One of the stars we were talking about in the Super Bowl game is Hines Ward, and he had an injury. No one thought he'd be able to make it to the Super Bowl, and not even before the start of next year. But this injury recovered in 2 weeks?
Well, what it does, the body has a normal injury healing period, and it's about 6 weeks. So a major injury like a medial collateral strain that Hines Ward had can take quite a while to heal. What this treatment does is squeeze down and speed up that injury process, that healing process, so that they're able to get back to play a lot sooner.
We were talking earlier, I had an old rotator injury years and years ago. Is that the kind of injury that this could work on as well, or is it just the things we hear about with the well-toned sports athlete? Is it for the weekend warrior and the moms?
Well, that's a great question. You don't have to be a sports athlete for this treatment to work. It works on everybody, and we've been using it for about 1.5 years at Capital Spine and Pain Centers to treat neck pain, strains, arthritis of the neck, rotator cuff strains, shoulder problems, back injuries, spinal injuries, and also arthritis of the hip and the knee. It's been very promising in the ability to slow down the progression of that arthritis. It's not a cure for arthritis. It doesn't reverse the arthritis and give you a new knee. But if you're looking at a knee that's degenerating and with arthritis, it can slow that process down and hopefully put off the need for surgery for the years.
Is this FDA approved? Is it now covered by insurance? If I went to an orthopedist and said, please look at me for PRP?
Well, it's FDA approved process, and it's covered by most insurance companies because it's very cost effective. This is not a hospital-based procedure. It doesn't require surgery. We basically do it in the office in a sterile environment. It takes about 1.5 hours. We draw a little blood from the patient, spin it down in a special machine.
Get those platelets.
And get those platelets, and it concentrates the platelets much higher than is naturally found in the body. Then we inject those platelets right into the site of the injury, and that jump starts the injury process and supercharges it, and it heals much more completely. And in many cases, if you do an ultrasound or an MRI before and after, you can't tell where the injury was.
My goodness, it sounds great. Doctor, thank you so much for being here with us. I'm going to ask my doctor about this. Right now.